The Illinois Department of Public Health is putting a greater emphasis in their search for lead risk in communities. They recently added new areas that are considered to be at risk for lead exposure for children. WCI 3's Jack Crum joins us in the newsroom. Jack, how many new ones were added?
Brandon, as of Monday, IDPH added 148 new zip codes from parts of 60 Illinois counties. One local doctor says not to panic, but to be aware of what this means for young children in the areas at risk.
We are casting a wider net as for those kids that we want to have tested.
The Illinois Department of Public Health is casting a wider net for possible at-risk children when it comes to lead throughout central Illinois. Kurt McAfee is the lead program manager with IDPH. He says the new areas were added through an algorithm showing where lead exposure could be more prevalent, like in communities with houses built prior to 1978.
They are living in older neighborhoods, they're living in older homes, they're in those areas where we have determined that they may be at higher risk of lead exposure.
The total count for certain high-risk areas in Illinois is now at 1,200 different zip codes, including some new ones in Champaign, Macon, and Vermilion counties, and 2 in Urbana, 1 in Oriana, and 1 in Danville. McAfee said the jump can be credited to a low level of accepted lead in communities, which is a good thing.
At a health intervention was 10 micrograms per deciliter. In 2019, the state moved that intervention level from 10 down to 5 micrograms per deciliter of lead in blood.
It's McAfee's expectation the CDC will be changing their recommendation from 5 micrograms to 3.5, which could see more places added.
Lead can cause significant neurotoxicity, especially dangerous for young children.
Andrew Zazada is a doctor at OSF. He explains the rise of at-risk areas.
Up until now, we've kind of accepted higher lead levels in children and in adults. And newer studies have shown that even what we consider to be acceptable may still be too high. So there's a new level that we kind of have to follow.
Zazada says parents and guardians should monitor children aged 6 and under for signs of serious exposure. Although unlikely, signs include constant nausea or headaches.
There could be a lot of causes, but an important cause to rule out is lead poisoning. Talk to your pediatrician, and again, a simple blood test will give you the answer.
McAfee says a childhood risk questionnaire is found at all healthcare provider offices and should give parents peace of mind.
If there's an answer to any of the 10 questions on the CLRQ, that if there's a yes or a don't know, then the kids should be getting a blood lead test from their healthcare provider.
IDPH says it's their goal to have statewide universal testing for lead exposure in children by 2026. For a full list of which zip codes throughout central Illinois are at risk for lead exposure, head over to our website, WCIA.com. Reporting live in the newsroom, Jack Crum, WCIA 3, your local news leader.
Jack, thank you.